Hi, I'm Rosina Badal Munir and I'm going to demonstrate the lung ultrasound scanning with Sonon 300C. Now start the exam with holding the probe in a longitudinal plane and the marker facing towards the patient head, and make sure the chest is exposed as much as possible, and so that you can just evaluate the chest properly. So now draw the imaginary lines, the anterior axillary line and the posterior axillary line, and then the horizontal line by which you divide the chest into 6 zones, the anterior and the lateral and the posterior zone, which are again divided into by the horizontal line into upper and the lower zones. So we are adopting the 6 zone method. So if you look at over here, these are the dark shadow which you see over here. This dark shadow, this is the these are the rib shadows which appear when you put your probe in a perpendicular to the ribs. So the ribs appear as hyperechoic and they will give the dark black shadow. Now it is very important that your probe should be lying perpendicular to the ribs and the pleura. So in between these two ribs you will see this thin hyperechoic line, and you will see the shimmering movement of this line, and this is the pleura. So you will notice the pleura and the sliding movement, and if you see the equidistance to this pleural line, you will see the horizontal white lines. So these horizontal white lines, if you look at over here, these are called the A lines. So this is the reverberation artifact, and this shows you the normal lung, normal aerated lung. So we start the scanning by moving from the upper zone and then move it all the way to the lateral side, looking at our landmarks, the two ribs and the pleura in between, and this is the pleural space, and we are looking at the A lines for the normal aeration. So then move the probe downward so that you can see the other probe, other A region, and then move it all the way to the medial side. And similarly, again, you will slide your probe downwards towards the lower zone, and over here you will see the liver. So if you look at over here, I can see this is the liver. This is the liver. So now you are in the lower zone. This is the IVC. I just increased the depth because depth was, I have to adjust the depth properly. So look at over here, and now I can see the liver, and the above the liver you can see this hyperechoic line. This is the liver, and this is the hyperechoic line. This hyperechoic line is the diaphragm. So in the lower zone, we look for any presence of any pleural effusion. So if you see, I'm looking for the pleural effusion above the diaphragm. So when I ask the patient for the lateral zone, we ask the patient to raise the arm. So look at over here. And now I will start scanning the lateral side. Now this is the video clip which we recorded, and you can see the nice shadow from the ribs and the pleural line over here. You can see the A lines, and this shows the normal aerated lung. So similarly, we scan the lateral side also from side to side, and the moving all the way towards the longitudinally upward towards the axilla. Looking for the shadow of the ribs and the pleural line. Perform the scanning all the way towards the axilla till we don't see anything above. Now for the evaluation of the posterior side, ask the patient to sit up, and then it is better if the patient rotate the hands internally, and again starting from the lower zone and longitudinally upward, and also from side to side till you reach the upper zones, posterior upper zones, looking for the same landmarks and the A lines. So we see the rib shadow, pleura in between, A lines, and sometimes you also notice some of the B lines, but the normal looking B lines. This is a case which is shared by the physician from the South Korea hospital, the COVID-19 confirmed case suffering from the pneumonia. So if you look at over here, the X-ray shows the diffuse opacities of in the on the chest X-ray. Lungs. Now the ultrasound image with the Sonon 300C of this patient shows the diffuse B lines, which are spreading all the, you see these white lines from the pleura, and they are spreading as they approach to the bottom of the screen. The normal B line is thin, straight, and it is not spreading. But if you look at over here, the patient lung scanning shows you the diffuse B lines. You cannot see the A lines, and this shows the lung inflammatory condition, and it is confirmed pneumonia COVID-19 case. You can just see all the B lines from this patient lung ultrasound. These video clips are also shared by the physician from South Korea. So if you look at over here, you will see the diffuse presence of B lines which are spreading and moving downwards. You don't see any A lines, and on here you can see some of the A lines, but on this slide, on this video clip, you see the diffuse presence of diffuse B lines, which is consistent with the condition of inflammatory condition of the lungs with pneumonia. This is the echo of the same patient, and you can see the right heart strain in this patient. So this is the end of the complete lung evaluation of the COVID-19 patient with Sonon 300C. Thank you so much.